If your baby was born prematurely, you may be concerned the same thing could happen with your future children. But are you really more at risk? What factors typically result in preterm births? And what can you do during your pregnancy to make it full term? Vicki Lombardo, Associate State Director of Program Services for the California chapter of the March of Dimes, is joining us today. We are discussing ways we can reduce premature births. This is Preggie Pals, episode 61. Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggie Pals, your pregnancy, your way. Welcome to Preggie Pals, broadcasting from the Birth Education Center of San Diego. Preggie Pals is your weekly online on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Sunny Galt. Are you looking for an older episode of Preggie Pals? Be sure to visit the episode link on our website and check out the episode guide for links to all of our shows. And thanks to all of our loyal listeners who have joined our Preggie Pals Club. Our members get all of our archived episodes, bonus content after each new show, plus special giveaways and discounts. You'll also get a free subscription to Pregnancy Magazine. You can see our website, preggiepals.com, for more information. And another way for you guys to stay connected is by downloading our free Preggie Pals app. It's available in the Android and iTunes marketplace. So let's meet other ladies joining us here in the studio. Molly, let's start with you. Tell us a little bit about yourself.
All right. My name is Molly Riffle. I'm 32 years old. I'm a teacher. My due date was May 16th, and I have two little girls. One is 2.5, and the other one is now 11 weeks. I had vaginal births with both, and with my second one, I had preterm labor. Started out with a little bit of spotting and cramping, and throughout the day, it just got more intense cramping, but just like period cramps really low. And by the end of the day, intense, non-regular, like I wasn't on a regular, wasn't cramp or contracting regularly, but I went to the hospital and they tried giving me magnesium. That didn't work, and 4 hours after I got to the hospital, she was out.
Oh my!
So
goodness.
It was really quick, very intense, very unexpected.
Wow, because I remember I met you and I thought you were only around 30 weeks, and then I saw something on Facebook about you having the baby. I'm like, oh my gosh, what just happened? Did I totally lose track of time here?
Yeah, it went really quick.
Oh
it was
my
very,
gosh.
I mean, even the doctors told me when I first went in, they're like, oh, we'll stop it. You'll go a couple more weeks and you'll be fine. And after about 2 hours on the magnesium, I was like, this isn't working. I'm getting more, my contractions were getting more regular. They were spacing out to 3 hours and or 3 minutes, and they were getting very, very intense. And they're like, no, it's supposed to be, not as intense. I was like, well, it's not happening.
Right.
So it just, I think my labor was total from start to finish was like 12 hours.
Oh my goodness.
So it was
fast.
Crazy.
It was really fast. Yeah. Wow. Okay. Stephanie is joining us here in the studio. Stephanie is our producer, Preggie Pals, and she is our social media guru who is checking out Twitter and Facebook. If you guys want to join our conversation, you can join our little Twitter party by following hashtag PreggiePalsVP, which stands for virtual panelist. So Stephanie is going to be checking that out throughout the episode. Stephanie, tell us a little bit about yourself.
I am Stephanie. I'm 30 years old. I have how old is she? Almost 6-month-old daughter. And like Sunny just said, I'm a producer for Preggie Pals.
Yay! Okay, a little bit about myself. I got some interesting news recently. I am pregnant. I thought I was going in for a routine appointment, and this was for like a pre-screening test, just first trimester stuff. And we're discovered we are having twins.
Yay!
So I got this news a couple weeks ago. So I thought we were going to be a family of 5. We are now going to be a family of 6. So I have 2 older children. One is 3. My oldest is 3. My youngest is 1, and we've got 2 little babies on the way. We are due in December. I hope I make it to December. Gosh, you guys, I just feel like this pregnancy is just off the wall. Like, I don't even know what's going to happen. I thought, okay, with a singleton, you know what's going on. You know what to expect. I've been through this a couple times already, and now I don't know what's going on. It's totally crazy. But anyways, regarding today's topic, I am really interested in this because, of course, with twin pregnancies, premature births happen all the time. I'm really glad we're doing it. So we will be right back. We have a question from one of our listeners. Carrie writes to us on our Facebook page, and Carrie says, I've been putting together my birth plan. I'm a little torn about whether to do a natural or managed placenta delivery. Wait, before I continue with this question, Carrie, sweetie, we never want to say torn and birth in the same the same sentence. That's bad karma. No tearing during birth. Anyway, she continues, I'm doing hypnobirthing, which recommends no Pitocin and no cord traction. I discussed this with my midwife, and she's totally fine with that if that's what I want. However, she would typically administer Pitocin right after birth. I've been trying to research both choices, and it seems like there's pros and cons for both routes, so I really don't know what to do.
Hi, Carrie. My name is Kara Messer, and I'm a doula and a hypnobirthing educator. Good for you for doing research on whether or not a managed placental delivery is right for you. It's good to know both sides so you can make an informed decision. The science behind using Pitocin after birth is to prevent postpartum hemorrhage by helping the placenta to eject faster and help the uterus clamp down and stop the bleeding quicker. But only 1 out of 100 women have a postpartum hemorrhage, and that's 1% of moms. In my own birth, I felt those odds were pretty good, so I asked my OB why they always gave Pitocin. She said that it's their safety net. If they have 10 moms on the floor and they all get Pitocin, they prevented what could have been a postpartum hemorrhage. She said that at a home or a birth center birth, you'd have a midwife by your side a lot longer to monitor your bleeding and blood pressure, so automatic Pitocin would not be so necessary. I followed up with a question about natural birth. If I chose not to get Pitocin at the hospital, what would happen? She said, you'd just get a nurse in the room monitoring you like a midwife. She wouldn't leave your side. I'm usually just too busy or need to get back to clinic, so I wouldn't be there. Pitocin helps me get out of the room faster as well, because if the placenta delivery is faster and I have to suture or whatever, it'll take less time than waiting for the placenta to naturally come out. It was great information to have, and I was so glad that I asked. Keep in mind that in natural birth, some awesome hormonal exchanges are going on between mother and baby. When the baby is placed on your chest right after birth and then allowed to remain there skin to skin, they begin to have pre-breastfeeding behaviors. The baby moves towards your nipple, they paw around it with their hands in their mouth. This stimulates the release of oxytocin, your love hormone, that naturally begins to contract and clamp down on your uterus. Then the baby's natural stepping reflex that they use to help crawl up toward the breast, those little feet also knead and massage the uterus, so it also encourages the uterus to clamp down and stop bleeding. Then once they latch and begin to suck, it increases the oxytocin release more fully, and that's why the cramping may become more intense when breastfeeding starts. All of these are your body's own natural safety measures that have worked for hundreds of thousands of years all over the world and still work today. Our bodies are amazing and pretty powerful if we just let them do their thing. It's nice to know that we do have a backup plan, though, if we are the 1%. But if we are the 99%, our baby and body will work together just fine. You can read more about the hormonal exchange between baby and parents during pregnancy and birth on sarahbuckley.com, and you can download her free ebook called Ecstatic Birth. Hope that helps.
Today's episode is all about pregnancy and preemies. The topic was submitted by Katie Mateague, one of our Facebook friends. And Katie writes, Hi, Sunny. I love the show. I've been listening since the beginning, even before I was pregnant. I'm 27 weeks with my third. I have 7-year-old twins who were born at 30 weeks. I'm really nervous that I will have another preemie and would love to hear from you about pregnancy after a preemie and how others cope with it. Keep up the great work. Well, Katie, thank you so much for this email, for suggesting it. I think it's a fantastic topic and something that really isn't talked about that much. So joining us on the phone is Vicki Lombardo. She is the Associate State Director for Program Services for the California chapter of the March of Dimes. That is a mouthful. I'm glad I got it out. And for those of you who don't know, the March of Dimes is a nonprofit organization focused on reducing premature births and birth defects. So Vicki, welcome to Preggie Pals.
Good morning.
Good morning. How you doing?
I'm doing great. Thank you for having me on the show.
Oh, absolutely. So, Vicki, let's kick things off by defining what a premature birth is.
Everyone needs to know, first of all, that a normal pregnancy is 40 weeks long. So a premature birth is any birth that happens before the completion of 37 weeks of pregnancy.
Okay. And then what factors typically lead to a preterm birth?
Well, when you talk in terms of researchers, they group them in about 4 categories of causes. 40% of the causes, when it happens, we don't know why it happens. But here are the 4 groupings, and one is infections and inflammation. And whether that's of the fetal membranes or it might be even dental or periodontal disease, it's an infection the body is fighting, can lead to preterm birth. The second grouping is maternal or fetal stress, and that can be chronic psychosocial stress, for instance, a woman that's not living in a safe environment, or it can be stressful for the baby because they're not getting enough nourishment for some reason. The body releases hormones that then cause the uterus to contract. The third grouping is bleeding, and that is often associated with the placenta and it wanting to let go from the uterus, and that will cause the uterus to contract. And the fourth is stretching. We're talking about twins this morning. I've heard that word several times. When there's more than one baby in there, the uterus begins to stretch. Now, it's not all bad about having twins. 75% of those pregnancies go on to term, so it can be done. But when you get to triplets and quadruplets and higher order multiples, those are always born preterm. The second thing I wanted folks to know is your lifestyle affects your risk for preterm birth. And there's a comprehensive list on the March of Dimes website at marchofdimes.com. But some of those are no prenatal care, smoking, drinking alcohol, domestic violence I mentioned, extreme levels of stress, working long days and standing long periods of time. And then the mother's health is the other thing. So the March of Dimes encourages women to see a doctor before you get pregnant to make sure you're healthy. For instance, that you're the right weight, you don't have an infection, you don't have diabetes, your blood pressure is normal, and there are several other things that they will check you for and talk to you about.
Okay, so I want to toss this over to Molly. Molly, first of all, there's probably a question of yours, why is this happening? Did they give you a reason, or were they able to break stuff down for you?
We were moving prior to the birth, so it was probably just a lot of bending over, standing up, packing, unpacking. Yeah. So that's what the doctor thinks, because I didn't have no other complications. With my first one, I had hypertension towards the end, but had no problems with this one whatsoever, and they think it was probably from moving, and I had the flu 2 weeks prior, so they think that might have softened my cervix because I threw up so many times. So combination between getting sick and then the stress of moving and actually physically, bending over and doing stuff.
Yeah, I feel like, going through that list of things that could lead to it, Vicki, I feel like there's a lot of things that could lead to it. It's a little bit scary.
It does. Not all of them are direct causes, but they all add to your risk, and that's what we're trying to do, is just reduce that risk. And one of the ones that I did not list is, if you're African American, your risk of having a preterm birth is twice as high as if you are a Caucasian or a Latina. So, and that's the group that we don't know about.
That's amazing. Well,
we don't have those answers.
Yeah. Okay. So one of the other things I wanted to discuss is elective interventions and how those can lead to preterm births. Can you tell us a little bit about that?
They can lead to complications with the baby primarily. We seem to be an impatient society. We want our food nuked instead of cooked slowly in the oven. And so we don't want to wait till 40 weeks of gestation, or we don't want to wait until we go into spontaneous labor. So it seemed to be an increasing trend that women were asking for elective inductions or elective C-sections. They didn't want to go through labor. And when those were being done before the completion of 39 weeks of pregnancy, now that's 2 weeks longer than spontaneous labor, those babies were getting in trouble, and they're going into the neonatal intensive care unit. So the March of Dimes is working very hard with doctors, nurses, and the general public to get them to understand that unless there's a medical indication, we should not cause a delivery to happen, either by C-section or by induction.
Yeah, and sometimes, we hear about this a lot in the birth community here in San Diego. We're making a big push for this not to happen as much. But, it's not always just the moms that want this, but we're finding that the doctors are pushing for this. I mean, they have their schedules and everything, too. So I feel like, it's a little bit of a two-way street here. But, the point is the same, and that is keep these babies in as long as we possibly can, right?
Yes, and I would encourage the moms, if the doctor is suggesting, hey, why don't you come in on Friday for an induction? And that frequently is the conversation. Or I'm going on vacation. I can probably induce you safely on Friday, something like that. One of the things the mom needs to know is not only there's a risk to the baby, but also an elective induction before 39 weeks increases her risk of having a cesarean birth by 50%.
Wow.
And we are encouraging women to ask the doctor 4 questions. There's a 5th one. The first one is, what is the risk to me and what's the risk to my baby of doing this? And the second set of questions is, what's the benefit to me and what's the benefit to my baby in doing this? So if you ask those 4 questions, that's a nice way to begin that conversation with the doctor. The last question is, so how was my pregnancy dated? So sometimes there's lots of ultrasounds done, and there's a time frame when the dating of a pregnancy by ultrasound is accurate, and then those later ultrasounds, when we're so tempted to change the due date, those aren't as accurate. And so we want to make sure that he is following the right criteria for dating the pregnancy.
Okay. Yeah, and I feel like that's all over the map sometimes too. Like I know when I went in for my 8-week ultrasound, believe it or not, the ultrasound showed a singleton, which was obviously off, and it also showed that the baby was measuring small, and so it totally threw off the due date. Which honestly, I don't even know what my due date is anymore. I don't know if they changed it. I mean, this whole twin news is new for us, but I feel like more and more moms that come on Preggie Pals say, you know what, one person gave me this due date, another person gave me this, and you don't even really know what it is, right? So that's kind of scary because, if you don't know when the baby is really supposed to come, then if they try to take it early, they could really be taking it early,
Yes. So the safest way to know it's time for the baby to deliver is to go into spontaneous labor.
Right.
That's the safest way. But there's also the American Congress of Obstetrics and Gynecologists. That's the professional organization, set standards for that for all the doctors to use. And so if they use those standards for dating pregnancies, then you're going to have the most accurate estimation of your due date.
Okay, makes sense. So, Vicki, I feel like, we've been talking about preterm labor, but a lot of the people that listen to our show are pregnant for the first time, and they may not know what, labor even feels like, or even preterm labor, or what some of the signs are. So can we go over that a little bit? I know everybody's pregnancies are different, and what they feel, in going into labor may be different, but what are some of the common signs of preterm labor?
Some of the common signs are a feeling of tightening of the uterus is one of them. Those are called contractions. It tightens like a fist, and it will do that on a regular basis. That's one way, but not everybody feels that. The second would be a change in vaginal discharge. It feels like you're leaking a fluid. There may be a little bleeding from your vagina, whether it's brownish or reddish, because the cervix is starting to stretch. A third way is just pelvic pressure, feeling like the baby's pushing down. It's not feeling hard. It just feels different. A third subtle one, or fourth one, is low or dull backache. It's just everyone who's pregnant has a backache, but this one seems to come and go. The other way to describe it for folks is just as women feel menstrual cramps differently, the same thing is true with labor. So if it feels like you're having like menstrual-like cramps and you're in the second half of your pregnancy, that could be preterm birth. And then some women will describe it like they're having intestinal cramps, like you have diarrhea or something like that. And that may be what you're actually having are contractions. So those are all times when you should call your doctor and talk to them about that.
Okay.
I know that when I had my first child, I was cramping everywhere, all over my belly, everything. And with my second one, I was cramping just from the bottom. That's why I didn't think I was going into labor, because it was just, just at the very bottom, just the base of my pelvic bone. Okay. That's the only place I was having the cramps. And the doctor's like, well, it could be preterm labor. I'd had Braxton Hicks before, and that was all over. So that's why I thought this was, no big deal, something different. I just, strained myself. And the doctor said, no, it could be preterm labor. Come on in, let's check you. And because I had let it go for probably 6 hours before I even called the doctor, because it was just, wasn't a big deal to me.
Could you time them at all?
No, and that's the thing, is it was coming and going, and there'd be times where I could go for 40 minutes and no contractions, and there's times where I could go for consecutively for 2 minutes. And there was no rhyme or reason to what was going on. And that's when I finally went, okay, something's happening.
Wow.
Yeah. And then I also had the spotting.
Yeah.
And that's what kind of scared me, was the spotting.
Yeah.
So I didn't have that at all with my first one.
So these were brand new symptoms
Right,
that you hadn't
right.
experienced before.
Yeah.
I think it's helpful to have already had a pregnancy to kind of know what to
Yeah,
expect, because
to compare it to, yeah.
And yeah, they can be different across the board, of course, but we get more like red flags.
Yes,
you know, oh,
yes.
this isn't the same.
Right,
you know?
right.
So Vicki, for listeners that are listening to this episode right now and have had a premature baby in the past, I know they have a lot of questions about this, and we'll dive into that a little more in the second half of the show. But what are your odds of having another premature baby if you've already had one?
Well, when you look at at overall in the United States, everyone has a 5% chance of having a preterm baby, whether they've had one or not.
Okay.
When you've had one preterm baby, then you increase those chances to 15%. It's not excruciatingly high, and certainly you can have one preterm baby followed by term babies. If your first baby was term and your second baby was preterm, like Molly's, now you're increasing to 24% for the third baby. So you think about that as you plan your future. If you've had two preterm babies, then you're kind of on the track for preterm birth, and you're up to 33% then.
Okay, so it really does kind of build on your previous pregnancies, right?
Yes. Well, that's our best predictor. Again,
Okay.
remember, just as Molly had one term birth and then had a preterm birth, we can't tell you when it's going to happen for sure, but we do know in studying all of the data that there is an increased risk, and the best predictor of the risk of having a woman having a preterm birth is that she had one already.
Okay.
So we watch them much more closely.
Sure. All right, well, when we come back, we're going to discuss what options moms-to-be have in reducing their odds of having another premature birth. Plus, what should parents know if their baby is born preterm? We'll be right back. Welcome back. Today we're talking about pregnancy and premature births, and our expert is Vicki Lombardo with the California chapter of the March of Dimes. So, Vicki, what medical options do parents have to try and prevent another premature birth, or even stop labor if they happen to go into labor?
Well, I'll get to stopping labor later.
Okay.
But as far as the options that you have right now, the biggest, most important thing you can do is to see your doctor when you start thinking about getting pregnant.
Okay.
When you stop using birth control and you're actually trying to get pregnant, you want to have seen the doctor first, because then your healthcare practitioner, the he or she, can help make sure that you're as healthy as possible. That's one of the pieces that are so very important. So you're the right weight, your blood pressure's in control, you don't have high blood sugar, they've checked you for everything else, and you've stopped smoking.
Okay.
That's the first thing. Then for the women that are listening that have had a preterm birth, a single baby, and it was delivered preterm, then we have a medication now that the doctor can give you during this second pregnancy that will decrease your risk of having a second preterm birth by up to 70%. And it's a great big long medical name, but it's friendly known as 17P. It's a progesterone that's given to the moms, and we're successfully helping moms that have single pregnancies, one baby, to go on to term in much larger numbers now.
It's a shot, Vicki? Is that what you said it was?
It's a shot, and you get it weekly.
Okay.
Yes, from your doctor, and they know you're at risk, and then you get it throughout your pregnancy.
Okay, but you have already had to have a premature baby in order to get that.
Yes, you wouldn't give it to someone that we have no indication that they're going to have a preterm birth.
Okay.
Now, the doctors will go deeper into it, and I do not have the expertise of a doctor. I'm a nurse, but I don't have an expertise of a doctor. There are gels and things that they can use if your cervix is getting short, and there are other conditions going on, so all hope is not lost for everyone, but we do know that this 17P has been very effective, and we're encouraging all the doctors to use that with their patients. Oh, stopping preterm labor. The bad news is that if a woman is truly in preterm labor, she can't be stopped. We don't know how to stop it yet. And I hear you say, but I had mag sulfate. There are several different drugs that we can give a mom to slow down the contractions. Now, if you weren't in true preterm labor in the first place, those medications will stop those contractions. But if you're really in preterm labor, your body has decided it's time to deliver, we can't stop it, but we can slow it down, and it gives us an opportunity to give you two shots of a medication that will help the baby's lungs mature. Because the biggest risk to the baby is that their lungs won't be developed enough and we'll have to give them oxygen or something after they are born. So we give you these 2 injections. The second thing that slowing down that those contractions help with is a chance for the doctor to assess what level hospital you are presently being cared for in, where you are. If you're going to have a premature baby and there's not a NICU in that hospital, a neonatal intensive care unit in that hospital, then you should be moved before you deliver to the next level hospital where there is one to care for your preterm baby.
Okay, so I have a quick question. So if I could have gotten to the doctor sooner on the day that I started having contractions, because I only got one of the steroid shots because everything happened so fast. Is there a possibility if I had gone earlier, they might have prolonged my labor a little bit longer than the 12 hours?
They could. It's possible, yes. It's possible, but don't feel guilty about that.
No, I'm just thinking about for the next one. If we do have a next one, I've learned that, if I feel anything, get to the doctor. So if there's anything we can do, do as much as we can.
That's what you would want to do, and it's best for the baby, and it decreases the baby's respiratory complication risk if you can get both of those shots for the baby. Yeah.
Right. Okay.
So, Vicki, and actually this is a question for Molly, too. I kind of want to give our audience an idea of what it's like, especially within the first, I guess it depends on how early you end up delivering your baby, but in those initial days and even weeks, what parents can expect with a premature baby. We've been talking about the NICU, and again, I know everything depends on how old the baby is at the time of birth, but, Molly, let's start with you. Can you tell us a little bit about your experience? I know your baby just got out yesterday, so this is very fresh in your mind. If you had advice to give to parents of premature babies, what would it be based on your experience?
Well, our daughter was born with Down syndrome and also a congenital heart defect. Mm-hmm. So we pretty much knew that if she was going to be early, she was going to have to be in the NICU to be monitored. Okay. And the scare was, she was early, so we were going to worry about her lungs. Okay. Luckily, her lungs came out fine. But the first few weeks were tough, just adjusting to knowing that, she's here, something's going wrong. She went into heart failure early on as well. We were trusting our doctors and what they were saying, and we got to the point where we realized we needed to be starting to ask questions. And, why are you doing this? What's the reasons behind giving her this? Lots of questioning. They're there to help her, but they were also there it seemed like they were making decisions they were comparing her to other preemies. Right. Which she wasn't just another preemie. So we had to look at, her medical condition and say, okay, well, she's special. She's different than what you're used to working with. So how can you treat her as an individual instead of comparing her across the board to a preemie? Right. So for us, it was, asking questions. We tried to get second opinions. Our hospital, kind of didn't want to. On that? Yeah, very much. Yeah. So we ended up moving her eventually because we needed, she needed the care that she needed. So we took her out of the hospital she was into and we went to another one, which is, the hospital that everybody goes to, that we've talked to, who has Down syndrome babies, who has the heart condition. But we learned, ask questions. Why are you doing this? Get involved. Be as involved as you can so you know your baby the best, because you can't rely on nurses. They change, they have a 12-hour shift and they usually work 2-3 days a week.
So you have to be your baby's advocate.
Yes, and you have to know, is this what my baby normally looks like? Is their stool normal? You have to know your child so that you can say that something's wrong. Right. So you have to be as involved as you can be. Luckily, we were able to be there all the time. We had somebody to help out with our other daughter, and we were able to be there all the time. So we were able to watch her and be on top of her and know, okay, this isn't normal. Right. And step in and say, something needs to happen here, or, why are you doing this? Yeah. Do we really need to do that now? No. So questioning was one of the things we learned.
And she was in the NICU for how long?
She was in there for 79 days.
Oh, my gosh. Yeah. Wow.
It was a very long time. We kind of pushed towards the end to get her out just because it just came down to where she needed to eat. Yeah. Because most preemies, they don't eat for a while. Okay. So, because when they're born, before a certain age, they don't know how to eat. So they have to learn to eat. And for her, with her complications and her heart condition, she couldn't eat for an extended period of time. So she wasn't getting as much nutrients as she needed through the milk. So at the end, she was, she's on a feeding tube now that they put in through her belly. So she's able to eat, but they were just waiting to make sure she could handle it. And can we do this at home where we're all comfortable? And when they finally said, yeah, let's send you home, we're like, yes. It was a relief. It's a very big relief to be home.
Oh, I'm so glad. Okay. Vicki, is there anything you would add to that? I know there's probably a lot we could discuss, but any big tips for parents out there?
Molly hit the biggest one for what parents can do for the babies, because you do know your baby the best. But the things we advise parents to do, when a parent walks in, often the NICU is the very first experience they've had in a hospital, and it's a scary place. There's lots of tiny babies, there's lots of equipment, sounds, everything is different. And so being patient with yourself, know that this is a new world, you have to learn about it, ask questions, tell people how you're feeling, give yourself permission to cry and be sad because you didn't have that term baby that you'd been hoping and dreaming for. Knowing that your baby does need you, even though you're not making the decisions that parents of term babies are making, such as, this is my feeding schedule and I'm going to bathe my baby now and this is how I'm going to dress my baby. You can be there for your baby by touching your baby, talking quietly to your baby, putting a cloth in your baby's bassinet or isolette, that's the incubator the baby stays in, that smells like you. All of those things help the baby to calm down and actually respond much better to the treatment that the doctors and nurses are doing.
That's one of the things I would also suggest is finding support. The NICU we were in, we weren't able to talk to their parents because each baby had their own room, so we were very isolated. So for the first few weeks, I was severely depressed because of I'm here by myself, my baby's struggling, we're having problems, my family's broken up. So to be able to talk to somebody else and somebody who's been through it and who's experienced being in the NICU, because you can't talk to people who've never been there because they don't understand. And it's nice to be able to have somebody else go, oh yeah, I remember that, and I understand what you're going through, and then the sleeping with the blanket. I slept with the blanket every night, and then put it in my daughter's isolette so that she could smell me. And if I forgot to do it, my husband would do it, just so that she could smell us, so she knew we were there. Because we would spend the night with her. We were able to, but just having her smell us was my huge thing because she wasn't able to breastfeed. So having her know that okay, I'm still there, and then for moms who aren't able to breastfeed, a lot of NICUs won't allow you to breastfeed because they need to monitor how much the baby's getting in milk. We would do skin to skin, and I would just let her, I would sit there with my breast out, and she'd, be able to lick it and smell it, and so she knows that it's comfort as well as nutrients. And that was huge. I talked to a couple of the moms in the NICU once I was able to talk to their moms about it and told them, and they thought that was, it had never been suggested because the doctors never thought about it.
Yeah. They wouldn't let you pump even? I know they want to measure how much.
Right. I was able to pump. Okay. So she was getting breast milk.
Okay,
but
great.
I wasn't able to she wasn't able to latch on.
Of course.
And plus with her heart condition, to latch on breastfeeding is really a hard thing for them to do. So she wasn't able to go very long. She did in the beginning, and it was great. She was able to latch on and nurse, but they want to monitor how much they're getting. So they kind of push you to bottle feed.
Sure. Yeah. Vicki, before we wrap up our conversation, I wanted to give you an opportunity to tell people a little bit more about the March of Dimes. I think, we all have heard of the March of Dimes before, but I don't know if we really know all the efforts and strides you guys are making in this area of premature births.
So Molly touched on something that's very important to parents in the NICU, and that's connecting with other parents. So in addition to Preggie Pals, the March of Dimes hosts an online community of NICU parents. And you get there by going to shareyourstory.org. And that is where you can see other parents' stories, or you can actually become interactive. You can sign on and talk to one another. And we've just updated that website, so now you can find other parents in your geographic area. So that is very, very helpful. The March of Dimes, the mission is to improve the health of babies by preventing birth defects, premature births, and infant mortality. We fund research. We do professional and public education. We fund community services. And we also have a very special program called the NICU Family Support Program that's active in over 100 NICUs across the country, where we actually have a March of Dimes employee in the NICU, and their sole role is to help parents through this experience and to find their role in taking care of their baby. And then last but not least, we do advocacy. We change laws so that we improve access to care, and we get like newborn screening tests done on babies so that we can identify problems that can be treated before the baby gets into trouble.
Okay. Well, we're certainly glad this organization has been around. And for how long? It's like 75 years? Is that what I saw on the website?
Yes, happy birthday to us.
I know, right?
75
That's
years
fantastic.
old today. We're not today. We're 75 years old this year.
Yeah.
We were founded in 1938 to find a cure for polio.
Right.
And no one sees polio in the Western Hemisphere because of the work of the March of Dimes.
That is so wonderful. So awesome. Well, Vicki, thank you so much for being with us today and sharing your
welcome.
expertise, your knowledge with our audience. For more information about our expert as well as our panelist, you can visit the episode page on our website. This conversation continues for members of our Preggie Pals Club. After the show, Vicki will share some important questions you should ask your medical care provider if you think you're at risk for a premature birth. Before we wrap today's show, here's some maternity fashion trends from Crystal Stubendek of Borrow for Your Bump.
Hello, Preggie Pals. I am Crystal Stubendek, maternity fashion expert and founder of Borrow for Your Bump, where you can buy or rent maternity styles for a monthly rate. Today we are going to talk about the upcoming fall fashion trends for moms-to-be. These little ideas and wardrobe essentials are stylish and versatile as your bump grows and can easily transform your look as a new season approaches. Trend number 1 is the long sleeve mini. The key to this statement dress is to show skin in some areas while keeping others covered up. We love long sleeve styles that show off more legs. The trick is to keep the fit loose and flowing. Add a belt or tie over the bump, which will create curves. For fall, we love the colors of condiments. Think olive greens and mustard yellows. To tie this look together, avoid a skinny heel and try a comfy wedge boot. Trend 2 is sexy stripes. Whether you are more on the hippie side or if you want to create curves, stripes is one detail that works for many body types. Stick with thinner stripes and dark colors. Wider stripes can make your bump and backside appear larger. Focus on a fit that hugs your curves and has ruched sides. This type of dress looks good on many body types, whether you want to create curves or even balance wide hips. Tie the look together with some flat knee-high boots. For our third trend, prints are all the hype this fall. Have fun with different styles, but make sure that the colors match. We love a silky print dress for a more dressed-up look with purple and aqua tones. Dress prints down by taking a fun print blouse and pair with skinny jeans. For colors, we love orange, navy, and cream with a tan boot. You're probably seeing this next trend everywhere, leather. We love this look for moms-to-be. Pair a comfy pair of stretched leather leggings with a basic gray sweater, or for a retro look, try a navy polka dot blouse and a fun, rusty colored heel. Add a fun hairpiece like a birdcage for a sleek style. Our final trend for fall is dressed-up details. An incredible cocktail dress that can be worn from fall into winter is a must-have. Spice up the standard little black dress and find a style with beaded detail on an empire waist. An LBD with a little bit of lace is also seasonless. Many of these fall trends can be found at borrowforyourbump.com. Enter promo code PreggiePals at checkout to save 20% on your entire order. Thanks for listening to today's fall fashion trends, and be sure to listen to Preggie Pals for more great pregnancy tips.
That wraps up our show for today. We appreciate you listening to Preggie Pals. Don't forget to check out our sister show Parent Savers for parents with newborns, infants, and toddlers, and our show The Boob Group for moms who breastfeed their babies. Next week, we're launching a new series on Preggie Pals called Childbirth Choices, which explores some non-traditional options for birthing your baby, and we are kicking things off with an episode on home births. So this is Preggie Pals, your pregnancy your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.